Thank you, Madam Chair. The Antigua and Barbuda Trade Union Congress, we're indeed grateful for the opportunity to participate in this conference. Madam Chair, I would like to observe the protocols that you and others have already established. The theme for the World Day of Occupational Safety and Health is Join in Building a Culture of Prevention on Occupational Safety and Health. This theme is quite exceptional. Exceptional in the sense that for too long, our culture was and perhaps it still is one of dealing with infractions rather than getting to the root cause and use preventative methods. What is occupational safety and health? It is the promotion and maintenance of the highest degree of physical, mental, and social well-being in all occupations. In common law jurisdiction, employers have a common law duty that is an underlying moral obligation to take reasonable care for the safety of their employees. Although work is honorable, it can also be dangerous. Accidents are always there waiting to happen. All jobs have some kind of health and safety problems associated with them. Whilst some are obvious, there are others that are not. An example of the culprit is noise. There are a lot of issues going on at workplaces. We inhale them, we lift them, we touch them, we may even ingest them unknowingly or even unaware of the consequences. Although it is generally agreed that work helps to keep an individual in good health as long as it does not overtax the physical and mental capacities, various factors inherent in work can have harmful effects on workers' health. The type of work done, the physical and mental effort involved, the materials and the products used, the working environment, the conditions in which work is performed, and the way in which it is organized. Looking at some contributing factors may also help. We can look at unsafe working conditions, lack of training, badly organized work, absence of signs and labels, frustrations and mental state, uncomfortable working environment, too many work hours, and weak supervision. On the 22nd and 23rd of April, I had the pleasure, along with inspectors from the Labor Department, and I see some of the honorary inspectors sitting there. This was an eye-opening experience for us and for me also. I am, however, taking this opportunity to publicly express my appreciation to the Labor Commissioner and her dedicated staff for trying to ensure that workplaces at least meet the minimum standards that are laid out in the Labor Code. During those 2 days of business inspections, I had some startling observations as they pertain to health and safety in the workplace. One, we saw poor lighting. In one establishment, there was a sign, fire extinguisher. We're yet to find a fire extinguisher. In another establishment, there were fire extinguishers, but they were insufficient and not serviced, full of dust, packed away somewhere in a corner. You have bulk supplies stored on the top of an unroofed admin office, an accident just waiting to happen. There's poor ventilation. And the worst that I have seen is the emergency exit door, blocked with sandbags and bolted from the inside. I don't believe that door has been open for a long time. I am now taking this occasion to reprimand those workers who take those health and safety safeguards for granted. Be aware you might be signing your own death warrants. Some refuse to wear protective gears, or some do so occasionally. One worker made a very casual statement that something has to take us home someday. With an untimely death or injury, in most cases, their families left behind to languish. Another aspect that we can look at is the overtime effect. As we aged, we may start to develop the effect from our negligence or the dangers that we might have been exposed to. Then those might become societal issues. We become a burden on the healthcare facilities. Monies that were allocated to fix the roads and schools have to be diverted to healthcare. We might have to send workers overseas as the services might not be available here. As an umbrella organization for workers in Antigua and Barbuda, we are appealing to the Labor Department and our affiliates to ensure that proper safety standards are established in various workplaces. These are to be in accordance with Section D of the Antigua and Barbuda Labor Code. For our 5 civil service unions who have uncertainty as to the application of Section D, Section D4 makes the application quite clear, as it states, and I quote, "The division shall apply to workplaces belonging to or in the occupation of the government." However, we may ask, who is going to bell the cat? As a Congress, the first cat that we wish to bell is the Clearview Psychiatric Hospital. For too long now, the workers and inmates have endured working and living in unsafe and unhealthy conditions. We are calling on the Labor Department to make this government institution a priority. Too many workers have been injured at this institution, some as a result of exceedingly bad working conditions. I am also calling on the Minister of Labor to enact modern legislation for the proper functioning of the institution. Mr. Minister, Clearview needs a new home. When there are infractions in the workplaces and management becomes negligent, workers must report them to the various unions so the necessary actions can be taken. This would ensure that we may enjoy a safe and healthy working environment. As a Congress, we will continue to educate and train our affiliates on health and safety issues, but wish also to appeal to our affiliates to do likewise with their rank and file membership and encourage them to become health and safety ambassadors in their respective workplaces. In so doing, we will be able to join in building a culture of prevention rather than scrambling for a cure to the problems we may encounter. I thank you.